So the background of this work is functional gastrointestinal disorders and gastroesophageal reflux disease are very common GI problems seen by doctors all over the world, very prevalent in the general population. These disorders are usually considered to be quite distinct. Functional gastrointestinal disorders include the irritable bowel syndrome, functional dyspepsia, chronic constipation, and a number of other conditions. And gastroesophageal reflux disease is considered again to be quite distinct and separate from these other disorders. We've been studying over 20 years or more the natural history of these disorders in the general community. And we ask the question, are these problems really distinct, or are these disorders interrelated? Because in clinical practice, many patients present with a combination of disorders, and the disorders can come and go. We've also seen that in clinical practice. Hi, I'm Dr. Nick Talley. I'm based at the University of Newcastle in Australia, although in the past I was a consultant at the Mayo Clinic as well. So it's very nice to have this opportunity to talk about our research paper in the Mayo Clinic Proceedings. The title of the paper is The Natural History of Chronic Unexplained Gastrointestinal Disorders and Gastroesophageal Reflux over 20 years, a US population-based study. So we studied this in the Olmsted County population, where we obtained a random sample over 20 years ago of the population, over 1,500 subjects, and we followed those subjects and additional subjects we recruited over this 20-year period in a series of studies, basically 3 separate cohort studies. And what we found is a number of important things. We found the prevalence of all these disorders is very stable from time to time. So we know they're common, and the prevalence of each of these disorders of IBS, dyspepsia, constipation, GERD, they're highly consistent over time. But what we did find is the individuals with these problems transition, they change. About 20% get better over time. 20% symptoms disappear more or less spontaneously, at least based on the data. Other subjects, though, really transition from one syndrome to another, as if these syndromes really are intimately interrelated, as if these syndromes really are all part of the same or similar disease spectrum. And we clearly showed this for all of the conditions that we studied using validated symptom questionnaires. So we think this study is very important. It challenges the current classification system for these common unexplained GI disorders. And the data suggest these disorders, or at least a big subset of them, probably share a similar underlying pathophysiology. And if that's correct, that's paradigm shifting for the field. Look, I hope people will read this article. It is an important piece of work, we believe. It clearly needs to be further studied. We need to do further studies to understand whether and indeed what are the mechanisms that could explain the relationship between the various disorders. However, we have conducted other work which is consistent with this idea that classifying functional GI disorders and GERD as separate independent conditions is probably incorrect. And that's an important message for clinicians. And I also think clinicians need to recognize that when they see patients with GERD or IBS or similar conditions in practice, they need to think about the whole of the patient and the broad spectrum of symptoms the patient may have, as in at least according to this study and also other studies, many of these patients who present in practice have multiple conditions, and their conditions will change over time, which means their management needs to change over time. So that's the study in a nutshell. We are continuing this work looking for mechanisms that might explain the overlap and the interrelatedness of these conditions. And the work we're currently doing is looking at changes in immune activation driven by gut disease that may well account for perhaps the overlap and the transition of these disorders and the intimate interrelationship of them.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.